Doctors of Reddit, what is your most surprising I can't believe I need to have this conversation with an adult story? I'm a paramedic. I delivered a baby in the back of the ambulance and placed it on the mother's chest. I asked her what its name was. Can't remember if there was a boy or girl, and she looked at me and said, I thought you named it. I really should have ran with it, but I was too surprised that she actually thought that. I saw a patient for a follow-up after 3 visits in as many days for asthma. He was from another country, so this was the first time I ever met him. His lungs sound absolutely terrible, but he swears he is taking the inhaler every 2-4 hours with no relief. This raises suspicion to me, as the same meds are working in the air. I ask him to show me how he is using it. He holds it about a foot away from his mouth and does 2 puffs like Binnaker and swallows. I felt really bad. He had never received any education about his illness or medications. My great-grandmother used to do this. She was stubborn and wouldn't take any advice. So instead my family asked me to use mine when I was with her so she could see the proper way. I don't remember if she ever caught on. Working in a rural OBGYN clinic, I told a PT to try vitamin B6 to help with her nausea and morning sickness. She called back a few weeks later and told me that Walmart did not have vitamin B6, so she bought B12 and has just been cutting them in half. Well, I could maybe understand thinking the number is a dosage if you're unfamiliar. At least she can do basic arithmetic. Based on the other stories in this thread, that's a solid milestone. That coming to the ER for a pregnancy test is a very expensive way to do it. Apparently she didn't know you could buy one at the Rite Aid down the block. Seriously, don't come to the ER for a pregnancy test, cause the test results won't be the only surprise you'll be getting. Also, if you have diabetes, that you need to take your medication. No, getting fatter isn't the worst that can happen. The worst that can happen is that you'll die. That's why you're in the ER with diabetic ketoacidosis and suffering organ damage. It's why you're gonna lose your toes. Take your goddamn meds. That taking that weird plant they bought from a pharmacy online isn't 14.324 times better than chemo and doesn't only attack cancer cells because it likes the acid environment in it. I was living in China and taught English on the side to a student whose mother was a physician. This was in 2012, just prior to the London Olympics. The mother wanted to send her daughter to London with a school group to watch the Olympics but has reservations about it. I asked why. She said she was worried that her daughter would catch AIDS from using the public toilets. Yes, a doctor. I was that patient once. In my late 20s I was fortunate enough to have never had a boil. Nor did I know anyone who had ever had one, so when I got one under my arm I just assumed it was some sort of sore that would go away. When it grew to the size of a weeping golf ball and became super painful, I figured out it was a boil and knew that you fix boils by lancing them. Tried to stab it with my rusty penknife but chickened out and went to the doctor instead. I took my soggy tissue away from the mess in my armpit and the doctor literally jumped back in horror. I now know that boils do not fix themselves and should be immediately treated with antibiotics. Married a pharmacy assistant just to be on the safe side. OMFG. Finally something I can comment on. Well, here in Mexico we have something called social service. Our college education is free in some institutions, so we have to pay for it with 1 year of free work in a rural area. So the first month a woman in her 30s came to consult because she was feeling weird in the mornings since forever. I asked what her symptoms were and she told me that every day she wakes up feeling her mouth dry, and that feeling disappears in about 1 or 2 hours. Well lady, how many water do you drink? 1 or maybe 2 glasses. 1 at breakfast, and 1 middle day. Do you know what thirst is? Yeah, when you drink water so you can pee. So I had a conversation that took 1 hour long about what thirst is and how it feels. Also I had to told her that she needed to drink more water. I don't know what blows my mind more, the idea that someone can't determine that they're thirsty, or that someone can make it through a day on only 2 glasses of water. My sister, who is a new Redditor and hope sees this, is a doctor, and 25 years ago when she had her very first patient out of residency, and this patient refused to allow her to see her breasts, which were sore and needed a mammogram to check out a lump. So sister asks why, and this girl who is about 30 and single said matter of factly, oh, that's lesbian. We can't do that. It's against the Lord's wishes. She loves telling this story at the dinner table on family gatherings, especially to our religious side. I'm a paramedic and recently transported an idiot who self-presented to the local hospital, who found he was having a heart attack, STEMI, and needed him sent to a bigger hospital for treatment. During my assessment I asked him how long he'd been having chest pain, on and off for 12 months. He tells me, any family history, one of the biggest indicators. Oh, yes. Dad died of a heart attack. Brother died of a heart attack. Both of them first presentation. Stone dead on the spot. No fricking about. So, you have a 12-month history of intermittent chest pain, and a family history of your closest male relatives spontaneously chucking hearties and dying, and you've never got it investigated. Furthermore, the only reason you came to the hospital tonight is because your family badgered you into it. I told him he needed a solid kick in the ass. To his credit, he agreed. Loads of people are like this though, as they tell themselves it's nothing and get on with their lives in the hope it goes away. Instead of hypochondria you get hypochondriacs who, despite evidence to the contrary, think they're healthy. Not a doctor, but I agreed to pick up my good friend's wife from her pregnancy sonogram. Driving home, the wife tells me she's surprised it's a girl because the last kid was a girl and it's supposed to go boy girl, right? Statistically, that is more likely than many other patterns such as, say, boy girl squid rock. As a paramedic, had a patient barricade his elderly mother and grandmother in the house, threatening to kill himself and them. Eventually he let them out, but still threatened to kill himself. We're all waiting outside. We actually have to park the ambulance a few blocks away until police declare the scene safe. PD calls us on the radio and tells us that they have the patient and we need to take him to the hospital. We drive up and hip out, and here's this 40-year-old man in a bathrobe, with what looks like a paper cut on the inside of one forearm. While calling the hospital to tell them we're on our way, I say patient has a very superficial cut on his left forearm. The patient hears me, and goes, what do you mean superficial? So I explained that it was a very shallow cut on his arm and that he'll be just fine. He says, I'll be just fine. I tried to kill myself. I cut my arm and then stopped when it started hurting. That's how I figured I did some damage. I was honestly dumbfounded. So I'm only an EMT, but I want to weigh in here to this conversation. I had to tell a patient with severe pneumonia, and the patient's family, that you don't get sick, that is, catch a cold, by leaving your skin exposed. The family was vehemently debating me on the fact, claiming that I had no idea what I was talking about because I'm not a doctor. Attempting to explain to them the necessity for a foreign body to enter your system was the most preposterous thing to them. My parents always told me that the reason I got sick was because I wore t-shirts to bed. Yes, mother, I got the flu because I exposed my forearms and hands as I slept, not because half the kids at my school were probably off dying from it. I'm a dental hygienist and once was telling a patient after a cleaning that she had gingivitis. She replies with, I must have caught it from my boyfriend. Had to explain to her that it's because she doesn't brush floss enough. She was 36. I had a patient drive himself to the neurology clinic who ended up being completely deaf, cortically blind in half his visual field, and demented to the point where he didn't know what decade it was. That's honestly impressive. From when I was a resident, working in the living heck that is the Ginny R at a major Florida hospital, woman comes in complaining of missed periods. Hasn't had one in 2 months. Me, do you think there is any chance you may be pregnant? Patient, no, that's impossible. Me, are you sexually active? Patient, yes, of course. Me, do you use protection? Patient, number. Me, do you think you might be pregnant? Repeat for 15 minutes. I think you're forgetting how ignorant the patients that you just described are. If you stapled a bag of pregnancy tests to the door, your patients would take the tests, but inevitably try to use them by spitting into the tests or shoving the tests into the rectum. Patient made an appointment and brought in his crap in a box. He was concerned about the size of his turd, and if it's normal. All he got from the visit was, normal turd. Yes, it's pretty wide. Turd box was set out with biohazard waste. Waste guy thought it was a misplaced package and put it on the front desk. Secretary got quite the surprise that day. Not a doctor, but a co-worker asked about a surgery we had just finished at the animal hospital I work at. The dog had a pyometra, pus-filled uterus, we removed. When I told her this, she looked at me in horror and asked how the dog was going to be able to pee without a uterus. She's 25. Doctor here. I think the most frustrating I've seen since I was a resident was a very pretty, like stunningly pretty, 17-year-old with what appeared to be normal, loving, affluent parents. She had a tumor in her pelvis, rhabdomyosarcoma, that we could resect to potentially cure her. The parents declined. Also declined chemo and said they want to try holistic medicine because that made more sense to them. I last saw her 3 years ago. She was getting huge lymph nodes removed from her groin because they were unsightly, obviously metastatic disease. Parents did not want primary tumor removed and again declined chemo. I see 100 patients week probably. Lots of devastatingly sad cases. But I still think about that girl, listening to her parents, costing her life. I bet she's dead now. I can assure people, doctors are not trying to swindle you, give you unnecessary care, or have some ulterior motive in this sort of setting. 99.99% of doctors are treating patients the same way they'd treat family, so try not to be dense. We want to help. I'm really late to this one, but maybe someone will get a kick out of it. A few years ago, the subject of human anatomy came up between a friend and I. He went on this whole tangent about how all men have uteruses because his college professor said so. I don't know if his professor was trying to explain trans men and some wires got crossed or what, but I had to explain to this fully grown man that he did not, nor did any natural born male, have a uterus. I sent him diagrams and told him to Google for himself if he didn't believe me. He said those were fake. Professor so-and-so said I asked him where he thought his uterus was and he said the same place yours is. When I countered with "oh, you have a vagina," he got quite angry and said men don't have vaginas. I explained that not having a vagina means not having a uterus. He laughed at me and said okay, just go ahead and believe that. Why yes, I will go ahead and believe anatomical facts. We weren't really friends anymore after that, especially since I asked about 20 times whether or not he was joking. Don't be too hard on him. It was probably his time of the month. Stepmom isn't a nurse. She used to tell stories about her fun patients she had. My favorite was always this. Severely drunk guy came in with signs of alcohol poisoning. They put a urethral catheter in him so he didn't pee himself. He didn't quite understand what it was and why he had it in his dong and kept on messing with it. At one point he tried pulling it out and my stepmom, she's not the very best at subtlety mind you, leans over and said in his ear, "If you pull that out now, your dong will never work again." Well, wouldn't you know it, he stopped trying to pull it out after that. I used to do patient transfers from outlying standalones to inpatient facilities. A guy had a balloon catheter and he cut the tube. It receded inside him and a urinologist had to admit him to remove it. I don't want my baby to get a vaccine because Jenny McCarthy's book says her son got autism from the thimerosal in his MMR vaccine. Jenny McCarthy is a one-time Playboy model who wants to sell you her books. MMR is a live vaccine and does not contain thimerosal. Thimerosal contains ethyl mercury which clears from your body in 10 days, unlike methyl mercury which stays for months and actually causes damage. Measles killed 135,000 people in the world this last year. Autism has a strong genetic component. If one identical twin has it, there is a 75% chance the other will as well, with 75% of identical twins both having autism. Andrew Wakefield faked the research linking autism to MMR vaccine, lost his license to practice medicine, and made millions helping lawyers sue and selling books. He lives in a mansion in England. I went to school for 11 years, spent 10,000 hours studying and just want to make sure your child stays healthy. Quit thinking your 5 minutes of internet research means anything. Get over yourself and vaccinate your dang baby. A mother came in with her son to discuss treating his acne. Son was about 15 years old and didn't really care about the acne, but mom did. After going over treatment options, she asked if he just needed to do it to get rid of the acne. A grown woman with a child thought that by him having sex his acne would magically go away. SMH. My father still thinks this will work for me and points it out during every conversation. Even though I am not a virgin, I am also 25 years old. Where the penis goes in the female reproductive system during sex. I had to explain this to a first year female medical student. So someone with presumably 4 years of a pre-med biology education. To her credit, she understood that the vagina was involved somehow. She just also thought the penis kept going through the cervix and uterus to the uterine tubes, and maybe further. There's a very, very old gif of an anime girl getting banged from behind, and on each thrust, the head emerges first from her right nostril, then her left nostril, then her mouth. I'm sifting through old hard drives and I can't find it. Google has no idea what I'm talking about. Not a doctor, but a nursing student. I was checking the car seat and walking a postpartum mom out of the hospital. Mind you, this was her 5th child. 5. She had raised 4 other children to adolescence. But for this one, on the way outside, she took a blanket and tucked it around the baby's head and face, nice and taut. Maybe 4 was enough. That having sex gets you pregnant. It was a 20-plus-year-old woman that couldn't grasp the idea that sex leads to pregnancy. She thought that in order for a man and a woman to have children, they needed to be married first and then have a baby. That sex was just an act unrelated to it. And NBSP. Then again, we are talking about a small rural community in the middle of freaking nowhere, Mexico. And NBSP. Edit. My highest rated comment. Awesome. Thank you. Also, it's amazing how common this misconception is all around the world. I worked with a woman, 27, who claimed she was a nurse before. She thought HIV magically manifested if blood was involved in sex. I made a joke about having sex while on my period and she was genuinely concerned about HIV. I explained one of the two would have to be infected for that to be an issue. I ended with telling her to Google it. This one is a little different. My dad is a pediatrician. He told me the story of a teenage boy, around 13 YO, who was referred to him, something unrelated, can't remember what. When he asked him if he was on medications, the boy's mom pulled out some birth control pills. Apparently his family physician suggested birth control as a way to treat his acne. Yes, you read that correctly. A licensed doctor told a teenage boy that was just going through puberty to take female hormones as acne treatment. I think he had been taking them regularly for the past year. I had a 20-something-year-old patient that came into the community OB-GYN clinic and was found to have chlamydia and gonorrhea infection. I looked in her chart, and she had been treated already for both in the past numerous times. And, looks like she had gotten pregnant and had a kid. I had the condoms prevent pregnancy and STDs talk with her. Apparently no one had ever told her that before. She had no idea. Made me realize community health is a huge problem, especially in low socioeconomic areas. My mother is a doctor. She once told me this story about a patient she had. She serves low-income people, so typically immigrants, minorities, usually without health insurance. The man is from Central America and is there for a normal checkup. Typical of most patients, he has fairly high blood pressure. However, this man is also having bowel problems. So my mother asks, what color and consistency is your feces when you need to use the bathroom? The man has no idea what she's talking about. My mom tries again. Your poop. What color and or consistency is it? Typically the man still has no clue what she's saying. He understands a bit of English. She tries again. Your doo-doo. Nothing. Your fecal matter. Nothing. Your poo. Nothing. Not number 1, but number 2. Nothing. Finally she asks, it's not liquid when it comes out, but it's more solid. You know, the man has an epiphany. OHH. You mean crap, he says. Yes, you're crap. So my highly educated, professional mother has to continue the rest of the checkup asking about his crap. What color is your crap? Is it more wet? Does it hurt when you take a crap? This went on for a fair amount of time. My mom nearly burst out laughing by the end of it. Absolutely amazing what a minor language barrier can do. I like to imagine she ended the visit by saying, well, your crap's all fricked up. I recommend such and such. Obligatory, not me but my wife. She's a nurse practitioner and had to explain to her 40-year-old man that brown sugar did, in fact, contains sugar, and that is most likely the reason why he now has diabetes. The same man also adamantly insisted his wine consumption was not an issue because he only drank the dry stuff like Chianti, so it doesn't have any sugar. I'm not a doctor, but I remember my friend telling me about this woman in college who could not grasp the fact that having unprotected sex while pregnant does not get the fetus pregnant. Not a doctor, but a pre-pharm student. But I once had a really bad stomachache, so my dad grabbed that Asian green oil stuff that smells like menthol and started rubbing my abdomen violently with the stuff. I adamantly suggested that we should hit the because I might have appendicitis. Then I finally found out that neither mom or dad knows what an appendix is. Then they argue with me that no such thing exists and insisted on using their method. Obviously it didn't work and my appendix exploded. Fun times. Not a doctor, but still this gem from a client. Cancer and HIV are caused by allergic reactions to things around you. So drink bentonite clay every day and your body will purge itself of the allergens and you'll be cured. I've never been more stunned. This woman was about 35 and has 2 kids. Yikes. Kids were probably not vaccinated. One of my university tutors had to explain how sex worked to a married couple. They had come into the clinic wondering why they hadn't fallen pregnant after like 12 months of marriage. The doctor asked the usual questions about menstruation, erections, etc. and the patient's responses were a bit weird. Finally she was like, "You are having vaginal sex." Yeah, the couple were really confused. The doctor literally had to explain that one partner needs to put their penis in the other's vagina and ejaculate in order to even try at getting pregnant. Apparently they were so shocked, they thought pregnancy just happened by itself after marriage. What always amazes me about these stories is that both partners are confused. I heard about a woman who came into the OR with vaginal bleeding. When they took a peek up there, they found a number of small round white pills. She learned 2 things a day. 1. She was pregnant. 2. Birth control works best when taken orally. Not a doctor, but worked in urgent care for a long time as a tech. Had a woman in her 30s come in for vaginal bleeding and an ABD pain. She was afraid she was pregnant and having a miscarriage due to a single missed dosage of birth control. Bleeding x 2 days, cramping, negative HCG, no recent sexual activity, last menstrual period approximately 4 weeks ago. It was her period. Not a doctor, but my human sexuality professor in grad school had some interesting stories. He worked a lot in very conservative Christian communities, and so a lot of times people got married with no sex education. He had one couple who couldn't get pregnant. Turns out they thought sleeping together literally meant sleeping in the same bed. Another couple was in therapy because neither one of them enjoyed sex or ever had an orgasm. After having them talk through step by step what they did in bed, he learned the guy was just sticking it in and nothing else. He told the guy to move back and forth next time and see what happened. The couple came back one more time to say thank you and didn't need any more sessions. That second story is probably my favorite in the thread. Thank you. As an optometrist, I've had several patients come to me for an exam because the medicine ran out of my glasses. I still wonder if it's just an expression they have, or if they really believe there is medicine in the glasses that runs out. Not sure if this fits here, but my uncle was a doctor and had a patient come in with his fingers cut off on one hand, minus thumb. My uncle asked him how that had happened and the man replied that he was mowing his lawn and he wasn't sure if the mower was on or not, so he put his hand under it to check and got his fingers cut off. A grown butt man didn't understand that putting your hand in front of a blade was not in fact a good way to check if it was on or not. I'm not a doctor, but I had a doctor sort of have this reaction with me. I like to use those earbuds with the interchangeable rubber parts. Well, one day I noticed my hearing was super off after listening to music on the bus, and I was missing a rubber earbud. After a while of the problem not going away, I went to the ear to see if I had actually gotten it stuck in there. Sure enough, the doctor looked into my ear, gave me a rather astonished look and confirmed I had gotten the rubber in my ear. I attempted to laugh it off as he was removing it, which he was quite proficient at, and asked if he deals with this often. Well, yes, but never someone as old as you, normally with 5-year-olds. I had a pregnant patient who swore she took her birth control pills as prescribed, faithfully, doubting I asked her to show me, to make sure she was taking one at a time etc. She then carefully placed the pill in her vagina. Sheesh. I'm pretty sure my grandmother is the person in all these stories. She fainted the other day. She's on dialysis and is supposed to stay away from red meats and sodium. When my mom asked what she ate, she said a ham sandwich. It's only now that it's actually threatening her life. But this is what she's been doing for years, even with insurance and a very well-paying job at a hospital. When I worked as a nurse in urgent care, we had a guy with a bad abrasion on his leg stemming from a fall down a flight of steps. He was prescribed a topical cream, among other things. Directions on the tube. Apply to the affected area. Sounds simple enough, right? Follow-ups. We noticed the wound was gross and not healing at all. He insisted he put the cream on the affected area and it just wasn't working for him. The doctor suspected something, so he had the patient demonstrate how he applied the cream so we can maybe offer some further help. The patient says he can't, because we're not at his house, and that's where the stairs are. This man was rubbing the cream on the stairs he fell down because the instructions said to rub on affected area. I refuse to believe this. I had a patient with a sebaceous cyst on the back of his neck, infected sweat gland. He asked me if it was an STD. You have interesting sexual practices, my friend. Not a doctor but a veterinary nurse. During the first Gulf War, a soldier came in with his cat. It was still as bored, as if the cat was made of plastic. He was a military intelligence officer, yet he still did not know his cat was dead. I hope he did not get PTSD considering how unfamiliar with death he was. I hope he did not get PTSD. I think the possibility he was already way beyond that line could exist here. If you are new to the channel, you can subscribe. I publish new videos every day. Until then, check another video. Bye for now.